Hi everyone, welcome to the 7 ways to become a doctor in America. My name is Dr. Manik Madaan. I am currently a resident doctor working in the United States, and in this video we will go into the 7 ways of becoming a doctor in America. This is very important for you to know so that let's say if one way does not work out, you have 6 other ways of getting into becoming a doctor in America. This video is based upon the most up-to-date data on each of the pathways. The first pathway will be going in is called as the NMC pathway. The second is the IMC pathway. The third is the UMC pathway. Fourth is the FBC pathway. Fifth is the FS pathway. Sixth is the SS pathway. And seventh is the institutional pathways. Out of these pathways, it is imperative that you know that the first 3 pathways require residency, and 4 to 7, this pathway sometimes requires residency. However, there are ways to get around residency. These 4 pathways, 4 to 7, do not require residency. So you can now technically come to the US without residency and practice medicine with the pathway 4 to 7. Let's start with pathway 1. Going into the NMC pathway. NMC pathway stands for National Medical School, where you as an international student go to your national medical school. That school has to be recognized by the World Directory of Medical Schools and also be on the ECFMG sponsor list. There's a new accreditation which is called as the WFME accreditation. As of now, it is not a necessity, but if your school is on the WFME list as well, that is regarded highly by the program directors and will help you in the match, but this is not a necessity. So during your medical school, you're going to be taking the USMLE steps, which includes step 1 and the USMLE step 2. Step 1 is a test of all your basic sciences, and step 2 is a test of clinical knowledge. And after you have done an exam called OET, which is occupational English test, you can apply for what we call as ECFMG certification, and using this you can apply for a residency program in the US. That's how most applicants get into residencies. They go to their national medical schools and then give all the steps and then apply for the ECFMG certification, which means ECFMG is a council which is called as Educational Council of Foreign Medical Graduation, which accredits international medical graduates and is the standard against which they can compare you against the American medical graduates. Once that happens, you can now apply for residency program in the US and then practice in the US. Pros and cons of this pathway is that you're in a familiar environment, and because of that, your college medical education is comfortable in many ways because you have family support. Secondly, this is cheaper than the other pathways. If you go to your own medical school, it's way cheaper. If you go into a US medical school, which we'll get into, or any international medical school, it tends to be more expensive, although there are exceptions to this rule, which I'll cover later on, where some pathways are cheaper than the national medical schools. This is the most streamlined pathway where you'll see a lot of examples where many candidates go through their national medical school and then apply for residency. However, the cons of this pathway is there is severe competition. As you're an international graduate, you are not familiar with the US standard of education, and you have to make up for that later down the line by paying more for the USMLE steps. So the cost here doesn't come here at the front end, it comes later on at the back end. And lastly, if you are going to your national medical school, you're not at par with the US standards as you study, you'll technically be eligible mostly for less competitive specialties, which is internal medicine, family medicine, neurology, psychiatry, peds, and so on. If you want to get into a surgical specialty, it is technically harder to get in there. Now let's go to the second pathway, which is called as the IMC pathway, or the International Medical College pathway. Here you go into an international medical school. This can be along the lines of Armenia, this can be Russia, or this can be China. Once you go to an international medical school, again, just like the National Medical College pathway, you have to write your USMLE steps. There's no getting around that. We'll also touch base on the other pathways as well. Each and every pathway requires the USMLE exam. There is no single exception that I'm aware of where it is not required. So to those of you who is asking me, hey, is there a way to come to the US without the USMLE exam? The answer is a firm no to that. So you've given your USMLE exams, just like the National Medical College pathway, you have to get your ECFMG certificate, which you give after step 1, step 2, and OET, and then you have your ECFMG certificate, which you get after graduation. And once you do that, you can now finally apply for residency program in the US. What are the pros and cons of studying medicine abroad? And this is what a lot of students don't know. Many students, at least in the country where I'm from, they have to write a foreign medical graduate exam to come to India. That's called as FMGE. They also have to do internship, but they don't have to technically do internship in their countries where they did their medical schooling from. For example, in Russia, China, and Armenia, they don't have to do internship. If they go directly for the USMLE pathways, they don't have to do FMGE. They don't have to go for internship even. They can bypass it, which is an option that is not available available for national medical schools. And some international medical schools may have less stringent admission requirements, especially if you're a pre-med, which means you have not gotten into medical school. It tends to be easier to get into these countries that I just elaborated upon. And the tuition fees here is also lower compared to both US medical schools and the private schools in your own nation. So sometimes that is the benefit of going to these places. Cons of this pathway is you're going into a new system, which is your international medical college, and the culture there can be challenging. And the other hard part about going into an international medical college is that your alumni tends to be weaker in terms of getting into US residencies. So these are your networking connections who can get you in. So if you're going into, let's say, the countries such as Russia, China, or Armenia, there's not a lot of alumni from these colleges here in the US, which might give you difficulty down the line in matching, because these schools are not the most tried and tested. Versus, let's say, if you go into a very reputed college of your own nation, the benefit of that is there's a lot of alumni from these places that are currently program directors in the US, and that gives you an opening into going into these programs because you have alumni. So just be cognizant of that. The next path we'll go into is the UMC pathway, or the US medical school or college pathway. What many people don't understand is that the US medical school is a graduate program. You have to do an undergraduate degree to get into a US medical school. So if you have to go into graduate school, you have to do an undergraduate degree, and that undergraduate degree is what we call as pre-med, which we'll get into. So anybody who goes into a US medical school has to have this undergraduate degree, and then once they get this undergraduate degree, only then can they get into a US medical school. Without that, it is not possible. This is very much unlike the systems in other countries where the undergraduate degree itself is the medical college or the medical school. But in the US, that's not the case. Medical school is more of an advanced degree, and therefore you need to have pre-med if you want to get into the US. The way it works is you have to give what we call a SAT, and once you give SAT, you get a pass, you get a good score. You apply for pre-med colleges in the US who are willing to sponsor F1 visas, which is a student visa where you can go and do pre-med in the US. If you're accepted, you'll get that F1 visa, and then you do your pre-medical graduate degree, which has its prerequisites, like it has to have biology certain years, it has to have certain other subjects. Once you're done with your prerequisites, you can take what we call as the MCAT, which is the medical school admission test, which is similar to in your country exam that you take to get into medical school. And once you get a good score on the MCAT, you get accepted to either a US medical school, or many students who don't get accepted to US medical schools, they go to DO schools, which is Doctor of Osteopathic Medicine. This is an equivalent degree to the US MD degree. So if you go to a US medical school, you get an MD degree. If you go to a DO school, what you end up getting is a DO degree. However, currently in today's scenario, they tend to be very much equivalent. The other one is going into a Caribbean medical school, which is, there are the Caribbean islands, they have a lot of medical schools. Many applicants who don't get into either the MD or DO pathways go into the Caribbean medical school, and then they apply for residency, which is similar to what you will see in the NMC and the IMC pathways. But this is more streamlined because the curriculum here actually integrates USMLE Step 1 and USMLE Step 2, which makes it pretty easy compared to the other pathways. So what are the pros and cons of pursuing medical education in the US? So the first pro is you get very high quality medical education, which is recognized worldwide. Medical education from what we call as LCME, which is USMDA schools, and the AOA, which is the board behind the DO schools. It is recognized worldwide. You can apply to Australia, the Ireland, you can apply to residency directly from these medical schools. So it's pretty robust. And being in the US itself will allow you to connect with US medical professionals and gain clinical experience, which will later help you to get into competitive specialties, which is an unfair advantage that the US medical students get that international medical students don't get. The other pro of this is because you are in a US medical school, any rotations you have to do in the US, which we call as electives, which is a prerequisite almost today to apply for the match, that will be covered by the medical school itself. Even if you go into Caribbean school, the first 2 years of a Caribbean school will be in the Caribbean medical school, and the next 2 years, which we call as the clinical years, will be in the US, where you will be rotating in certain hospitals in the US. So that is already integrated. So you're not paying in the back end here. So if you're in the NMC or IMC, you are paying in the back end later on when you go down the USMLE path and you have to, let's say, take the exams, you have to do the rotations. But for the UMC pathway, all of that is already integrated into the curriculum. So the cost is on at the front end. But this cost tends to be pretty heavy for a lot of students, which is along the lines of, if you come to the US, the debt here is close to about $200,000 to $400,000 for students who go to medical school and do pre-med here. And also it is a competitive process, which is not familiar to many international students because they don't know how the US works. So that can be a bit of a disadvantage and caveat to going down this path. But I know people, I have an interview video with someone, if you want to watch, who got into emergency medicine using this pathway by going to a DO school. Now that we have covered all the pathways which require residency, we're going to go into other pathways which don't require residency. The first of which is the FBC pathway. This is the fourth pathway along the line. Part of it does require residency. So let's go into this. What does this mean? So the full form of this is fellowship to board certification pathway. What that means is if you are somebody who's completed residency in their home country, let's choose surgery. You have done a residency in surgery, or let's say internal medicine. Now, what you have to do is you have to complete all your USMLE steps. You have to do the same thing as the IMC, UMC, and the NMC pathway. You have to do step 1, you have to do step 2, and you have to do OET, and this will give you an ECFMG certificate, which will make you at par with all the American medical graduates. This is a prerequisite to applying for what we call as the fellowship match. So residency has the residency match, fellowship has a fellowship match. So anybody who's done residency in their home country can apply for a fellowship that would be considered as a natural succession to the residency you did in the country. For example, if you did surgery residency, once you do a surgery residency, you will not be eligible for a GI fellowship because that's restricted to medicine. Only a medicine residency trained physician can do that. However, if you've gone through surgery, yes, colorectal surgery, yes, that is allowed, but that is restricted to your specialty. So let's say you apply for a fellowship. Now you have 4 options. The first option that I detail here is where you have to do what we call as reverse residency. The other 3 options here do not require residency at all. So let's go down the path of reverse residency, what that means. Let's say I am an internal medicine doctor. What I have done is my 3 years of internal medicine training in my country, then I apply for a fellowship. Here's where many people get confused. There are 2 kinds of fellowships in the US. There are ACG, accredited fellowships, right, which is the Accreditation Council of Graduate Medical Education. This is just like your national council, which gives the medical colleges or the residency programs the stamp of approval that they're robust enough to meet clinical standards. That's what ACGME is. You need to be in an ACGME accredited fellowship because this is the only way to get what we call as board certification. Board certification is like a national license to practice in that field. For example, if I'm an internal medicine doctor, I did a nephrology fellowship, which is ACGM accredited. That is the only way that I can end up getting into a board certification pathway. If you go into a non-ACGME accredited fellowship, which means it doesn't follow the standards of the ACGME, which most residents who have finished residency in an international country are applicable for, this does not get you this board certification that I'm talking about. And I'll get into this as well, what this means. So you're going to apply for a fellowship, right? There's 2 types of fellowships that I detailed before. One was ACGME accredited fellowship, the other is non-ACGME accredited fellowship. Technically, the rule is that IMGs can only apply to a non-ACGME accredited fellowship if they have done residency in that country. ACGME fellowships you cannot apply because of restrictions. ACGME doesn't allow that, but there's a way to get around this as well. So if you apply to a non-ACGME accredited fellowship, certain examples here could be, let's say, medical genetics. There's a lot of them. In psychiatry, we have community psychiatry. If you're a psychiatrist, that is a non-ACGME accredited fellowship. You as an IMG, if you apply here and let's say you match into that fellowship, you'll land a paid non-ACGME accredited job, which over time, let's say you work in a program, you start to get to know the program director, you network around, you can find a way to get into an ACGME fellowship where if you show them that you're really great at your job, right, you're a stellar applicant, they can apply for an exception with the ACGME and ask them, hey, this is a stellar applicant, I want you to make one exception here, and they can make an exception and get you in. And once you get in, you can then find a way to get yourself board certified. There are ways to do this, and I'll talk about how you can do that in many ways, right? That's one way. The other way to get around this is that you get into this non-ACGME fellowship. Once you get there, you have a paid position, and you can then, right, apply for what we call as reverse residency, where you can do residency in reverse. For example, you did a fellowship in medical genetics. Once you get a medical genetic fellowship for 1 year, you can then network your way around and go into an IM residency and repeat it for 3 years. That's one way. So that's the reverse residency way. However, let's say you go the other way, where you apply for a paid non-ACGME position, get into an ACGME fellowship, right? So from medical genetics, we are going to go into nephrology for a year. This 1 year of nephrology that you get counts towards your clinical training. And let's say you get into residency from here, which is called as reverse residency. You can apply, you can network around. This 1 year will be counted towards your training. So you might only have to do 2 years of internal medicine training. So that's the benefit of going into ACGME fellowships, is that the clinical training, number one, counts if you do anything else like residency. residency. Secondly, it is beneficial that not only just the clinical training counts, but towards board certification, which I'll touch base upon later as well, for a fellowship. So this is the reverse residency, right? You apply for a fellowship. I've gone about this. Does the fellowship meet the required years? They're going to ask your question, or do you need additional years? And once you get that, you go through, let's say, a non-ACGME fellowship, and then you go into an ACGME fellowship. You can bypass this step. You can directly get into ACGME fellowships if you're an exceptional candidate. If you're not, you have to go to the non-ACGME fellowship and then go to the ACGME fellowship. Once you do that, you can do a report residency. This could look like, let's say, if you are aiming for psychiatry, you can do 2 years of child psychiatry, which is an ACGME fellowship. Psychiatry here is 4 years. So you only have to do psych for 2 to 2.5 years now, because your clinical training counts here. So you repeat residency and then you achieve board certification, and now you have a national license to practice. What are the other 3 ways where you don't require a residency? How do you get in without reverse residency? The first way is what we call as the alternate pathway. The alternate pathway is a specially designed pathways for certain specialties. This includes radiology. The second one is ophthalmology. If you have done radiology residency or ophthalmology residency in your country, then you can apply for 4-year consecutive fellowships in programs where there is a pathway, what we call as the alternate pathways. For radio, this is called as the ABR pathway, which is alternate pathway for radiology for board certification. The second, for ophthalmology, the name goes by the ITO pathway. Once you do your 4 consecutive years of fellowships in an ACGME accredited program, this can happen here. Here, there is no restriction in these where you have to go through the non-ACGME route. You can directly go through 4 ACGME accredited fellowships in a single program. So if you go and do a Google search, you're going to find that there are many programs like in the Ivy Leagues, like Harvard, many top universities have this. So you do 4 consecutive years of fellowships in radio or ophthalmology in that institution, and then you are directly eligible for board certification, which is a national license, and you can apply for a job. These pathways, again, are specialty limited. The third pathway overall, and the second pathway in the no reverse residency route, is the special consideration pathway, where if you're an exceptional internationally trained physician who's done residency, and this is what you'll find in ABIM, which is American Board of Internal Medicine. There's other specialties where this also exists. For example, general surgery has one, and there's thoracic surgery, there's anesthesiology. So if you are in any of these specialty fields, if you're an exceptionally trained physician, and that's what they think, you have a lot of scholarly activity, you have research work, you are a trained physician in a clinical field that they lack in. For example, this could be infectious diseases. So this either could be research or this could be a clinician. You're an excellent clinician. You can directly apply for an ACGME accredited fellowship or go through a non-ACGME fellowship and then end up in an ACGME accredited fellowship. Once you're done with the ACGME accredited fellowship, for example, let's say nephrology. You did nephrology, which is an ACGME accredited fellowship, or you went the medical genetics route and then went into the ACGME accredited fellowship. After 1 year of that fellowship, you need to serve as a faculty at an academic institution. So you need to talk to the PD, you need to talk to the chair to create a role for you, and you practice in a restricted manner in that institution for the next 3 years, and they have a curriculum for you where you have to, number one, teach medical students and graduate, and secondly, do research. It can be sometimes either or, it could be a combination of that. If you do that, this 1 + 3 year pathway in about 4 years, if you do a non-ACGME accredited fellowship in 5 years, then so in 4 to 5 years, you can then apply for board certification and obtain a job. There is a way to do that, but this is for exceptional individuals. Talking about exceptional individuals, there's another pathway that you need to hear about, which is the 4th pathway in the series, and this pathway is the 3rd one in the no residency route. This is called as the pilot pathway, which the American Board of Internal Medicine currently is going to start. So be wary of what this is. If you're an exceptionally trained international physician, just like our special consideration pathway, and you do an ACGME accredited fellowship, which sometimes can be easy or hard to get into via the direct route. The indirect route is the non-ACGME one, and then you get into the ACGME accredited fellowship. Once you've done that fellowship for 1 year, if you can show that you are an exceptional physician, your PD, your chair, everyone vouches for you, you can then directly achieve board certification and obtain a job. But again, this pathway is in the pilot process. They haven't launched it. It's just development. They're getting reviews and seeing what's going to happen with this. What do program directors are thinking about this? As of now, this is a closed pathway, but there is a chance that this might get enacted in the future. Now that we talked about the fellowship to board certification pathway, which gives you a national license to practice in the US, what are the pros and cons? Sometimes the pros of this is that it's easier to match into fellowships than residencies. If you are somebody who has already completed your residency, sometimes in the match, your YOG can be a huge detriment, but the fellowship match is much more forgiving. However, it can be hard, it can not be, but let's say you want a non-ACGME accredited fellowship or something like nephrology, which is ACGME accredited. It's not hard to get into versus maybe internal medicine, which could be harder. Let's let's look at radiology. If you want to get into radiology, that's a better example. Getting into radiology is not easy as a residency applicant, because to apply here, number one, I have to get 1 year of prelim IM, and then I have to do a 3-year radio fellowship. So you have to apply for 2 matches at simultaneous time and then match, and it's a competitive specialty. However, if you are somebody who's already trained in this residency, you are a radio resident who's trained, right, in radiology, and you apply to the fellowship to the alternate path, which is the ABR path, which requires 4 consecutive fellowships. That's way easier than this line where you have to do the match twice, and hopefully you match into both a prelim IM spot, which is intermediary IM position, internal medicine position for 1 year, and then go into radiology. So this pathway may allow you to avoid repeating residency training in the US, which is the best. Securing a competitive fellowship sometimes can be hard. So for example, if you're an internal medicine trained physician in your country, if you want to go into GI, if you want to go into cardiology, there is very little chance you're going to get into, because even the US residents don't get into these, right? It's very competitive for the US resident to get into cardiology or GI, let alone internationally trained physicians. So if that's something that you're looking for, it's very hard to do that. The only way I can see that happening is doing a reverse residency. So you went through a fellowship, you did a reverse residency, and then getting into these competitive fellowships. Otherwise, it's almost next to impossible. Now that we've discussed about the fellowship to board certification pathway, we're going to go into what we call as the fellowship to state licensure pathway. In FBC pathway, the difference is if you go down the FBC pathway route, what you're getting is a national license in the US to practice in any state. But the limitations of the FS pathway is what you're getting is a state license that is not board certification. You're not getting board certified here. What you're getting is a state license which allows you to practice in that state. An example I can give you is if you apply to Florida and you somehow get a fellowship done and you find a way for a few years, you practice there, you get a state license, you can only practice in Florida and nowhere else. And there's other limitations that come to this if you're not board certified, which we'll talk about. So let's say you've completed your residency training outside the US and this was in surgery. We'll go with something very competitive. Once you've done your residency outside, you need to complete all your steps, same as all the other pathways. You have to get an ECFMG certificate. You have to try to have step 3. It's not a prerequisite, but it helps really if you want to land a fellowship position and get an unrestricted license. So I would go with both the ECFMG and step 3 for the FBC and the FS pathway. Once you get that, you apply for a fellowship. I also want to touch a bit about this in the FBC pathway. There are multiple ways to apply for the fellowship. One is similar to residency, which is called as the NRMP fellowship match. Then the other way to get into fellowship is what we call as the San Francisco match, which is a separate match of itself. Certain specialties are out of the match, which is urology match. So you have to look for what specialty is and participating in the match. Then the other way to get into fellowships is by applying for what we call as out of match positions, which are match positions which aren't displayed in the match. They do exist, but you need to have the connections to get them. The programs typically don't offer them in any of the matches. So that you have to try to find out by individually emailing program directors or if you have any connections who know people there. So you apply for a fellowship. Now what you have to do is, let's say you were in surgery and you did a certain fellowship in US that is a natural succession to surgery. What now needs to happen is you need to have 1 to 2 years of clinical training. This can be in certain states non-ACGME accredited fellowship, or this could be an ACGME accredited fellowship. What some states allow is if it's, let's say, a state like Florida. Florida might allow you to do 2 years of non-ACGME fellowships and then get a state license and you can then find a job. But most states want you to have an ACGME accredited training. This is the case for most states where you have to get an ACGME fellowship. You need at least 1 to 2 years of this, and then you can apply for the state specific boards and find a job. This non-ACGME fellowship route is typically rarer. There are a few states who participate in that, but it is much less streamlined and the opportunities are way more rare to go down this route and only in certain states. While this is much more common, the other way many candidates go around this is they'll find a non-ACGME spot, they'll network around, and then they'll go into an ACGME fellowship and then work there for 2 years and then meet the state licensing board. In a state which does not recognize non-ACGME training, any amount of non-ACGME training wouldn't help you in that state. It would have no effect. So you would have to get an ACGME fellowship for 2 years and then you can work on a state license in the United States only in that state. So what are the pros and cons of this? The pros and cons that I would say for this is this can be much shorter. For example, if we compare it to the FBC pathway, yes, you are getting that national license to practice, but this does take 4 to 5 years at least down the line, versus is a fellowship to state pathway, could take at max 2 years in that state. And in those 2 years, then you can start making more money. You will be paid for the spot, but then you can start making money. So this tends to be shorter, but is limited in terms of you, number one, being restricted to the state only. That's the con. Plus, the other con is many hospital systems, they prefer board certification because many insurances don't accept a state license. They need board certification. Because of that, this will also cause limited number of employment opportunities. So this is something you should know about. Now that we have talked about the FS pathway, I'm going to go into what we call as the SS pathway. This is the state specific pathway. This is the sixth pathway. So the SS pathway is another pathway where you can bypass residency training in the US. First, let me explain why this exists and then how you can do it. So what's currently happening in the US is there is a huge physician shortage. Because there's a huge physician shortage, the way they are trying to address this is, number one, they're letting mid-level providers practice. A mid-level provider is someone who's between an advanced level provider and somebody who's a basic level provider. An advanced level provider is somebody who is a board certified physician in the US. A basic level provider would be a nurse. So they are between doctors and nurses, and they can provide at least the most basic care. In the US, the way they're trying to address the physician shortage is either through what we call as nurse practitioners, where certain nurses, they can go to get trained in certain specialties like psychiatry, and then they can practice almost like a physician, but they have restrictions. They have to be supervised in some states they don't have to be. The second way to address the physician shortage is what we call as physician assistants, and these mid-level providers can practice under physicians, which is supervised care, and provide care to the patients. The third way to address this that they have found as of now is by getting IMGs who either have a residency, or if they have no residency, they need to have at least 4 to 5 years of experience working in their country as a basic medical physician. So if you're able to do that, then certain states, which is Tennessee was the first state to pass a law which allowed IMGs to come to the US and start practicing medicine. Later, Massachusetts is the latest one who just passed a law in December 24, which allowed international medical graduates with advanced training to come and practice in the US without repeating residency. And then Florida, Virginia, and Wisconsin are down the line also. They passed laws, and this keeps updating. If you want more updates on this, you can again sign up for the newsletter that I have below, and I'll update you on any opportunities that are available. Now let's go into how you can do it. For example, you have finished your residency training in your country, or have 3 to 4 years or 5 years of practice in your country. You have to still give the steps. You have to get, in some states, ECFMG certified. In some places, they really don't care about the ECFMG certification. So you can enroll in a mentorship program at a federal level facility in an underserved area, or there are other health centers as well that come under this who want to participate. But generally, it's an underserved area where there are not many doctors. You can enroll there for like 2 years. You have to be in a supervised environment where you are under a doctor who has board certification, and you can practice under them just like a resident, and then you can transition to a full licensure upon completing the requirements in that state. Let's dive into the pros and cons. Pros are, this is a faster route to licensure for experienced IMGs, and then there's no need to repeat residency. For example, we touched in the FBC pathway, the FS pathway. This required at least 4 to 5 years. The FS pathway, which is the fellowship to state licensure pathway, could require 2 to 3 years minimum. The state specific pathway would just require about 2 years. The caveat of this pathway is not streamlined. The requirements for each state are very specific. They're pretty different. So there's not a general guideline, and that sometimes makes it harder. And this is not available in all states, so it makes the opportunities rarer. And they give preference to green card holders because they don't have to sponsor visas for them. The other issue is the no board certification, which can lead to restrictions, like I said, which here would be limited opportunities because you don't have board certification. Many insurance companies won't take you. The second issue that would come here is, again, you're in that state, you can't go national if you want to. Now let's go into the seventh and final pathway, which is the institutional pathway. This is another pathway that you can take to bypass residency. How does this work? So in institutional pathway, if you are an extraordinarily trained international physician, and this does mean you have done residency, and let's say this could be in terms of either clinician. If you're a clinician, you have done multiple fellowships that they cannot find a replacement for you in the US, and you have demonstrated scholarly activity. That's a clinician track. The other way would be a research track. Let's say you might not have a lot of clinical experience, but you have actually made some groundbreaking research contribution or scholarly contribution that they think you're extraordinary. There is a way where, let's say you come and do a fellowship here. You can network your way around, and at certain academic institutions, they can give you a license to practice within the academic institution. This is something you'll see with UPMC, which is University of Pittsburgh Medical College, where they pick select medical talent from, let's say, I know in neurosurgery. The this exists, and I've seen this exist in psychiatry, and I'm pretty sure this exists in other fields as well, where you can get a license to practice in that academic institution and not outside of that. So in an academic program, sometimes let's say they don't allow you to practice. One could be you could just be a clinician where you can take care of patients only in that institute. If you don't want to be a clinician, you could be a researcher. You won't get a license to practice, but you can push the field forward with that research license. Or you could be a faculty where you could just teach, but you don't get a license to be a clinician. What are the pros and cons of the institutional pathway? It is a unique opportunity to work in a specific institution like academic institution in a research setting. This could be clinician setting. This could be a faculty level setting without repeating residency. The cons that comes with it is it's very limited, not widely available, only for very extraordinary individuals. And the only other issue is you cannot practice medicine outside of that institution, where if something happens in that institution, you're literally out of a job. You won't be able to stay in the States unless you have a green card. So that is a big limitation. So now that you know the different pathways to practice medicine in the United States of America, all you need to know is how to do the USMLE, which I go into full A to Z detail in this video here.